The coronavirus situation in the United States is dire. Hospitals are overwhelmed as cases have gone up exponentially, with more than 4 million people infected in the month of November alone. And while Trump might try to downplay the severity of the virus, his own government has an internal map showing that nearly the entire United States has become a COVID hotspot. And we still haven't experienced the surge that will surely come from Thanksgiving. I'm joined now by Dr. Bernard Ashby, cardiologist and Florida state lead for the Committee to Protect Medicare. And by the way, Florida became the third state to surpass 1 million cases today after Texas and California. And Dr. Ashby, I watched earlier, was watching MSNBC earlier, and they were talking with the mayor of a Miami city, of a Miami-Dade city, about their complete frustration that they can't even have a mask mandate in Miami, Miami Beach. These cities can't even do anything because the governor of the state of Florida has said you cannot do anything to close businesses, to make people wear masks, nothing. You can't even find people in the state of Florida. What the hell is going on down there?
So great question, Joy, and salute from Miami. And as we say, what's going on? Okay, but unfortunately, Governor Ron DeSantis is completely showing a pattern of mishandling this virus. And at first, I thought that he was just misinformed, but it appears that he actually doesn't really understand the level of the severity of this pandemic, and he's actively making decisions to ensure that Florida will become the epicenter of this pandemic in the next few weeks to months because of his decisions. And he's actually preventing the mitigation measures that we need to implement now to prevent hospitals from becoming overwhelmed. And unfortunately, we're going to be left with no option but draconian measures such as stay-at-home orders, aka lockdowns, that no one wants to have because they have detrimental effects because he's not doing his job. And there's quite a few leaders around the country who are not doing their job, and they're going to wait till the bodies start piling up to then resort to reactive measures such as stay-at-home orders to get this pandemic under control. Because as far as we can see, there's no measures being taken place right now, and it's unfortunate. So
there's the panel in charge of determining who should get a vaccine when it comes out first, which again is not an immediate panacea because we're not talking about everyone in America being able to get a vaccine tomorrow. We're talking about somewhere in the middle of next year, but the first groups of people who would likely get it would be healthcare workers and residents of nursing homes. Florida is the state with the oldest base population. The most senior citizens in the country live in Florida. It's a state with disproportionate numbers of senior citizens, and therefore it's one of the reasons you have disproportionate amount of death there. Do you get the sense that people like the governor are seeing a vaccine in the future and deciding they don't have to lift a finger to stop the vaccine, just to stop the virus because the vaccine will fix it?
Exactly. I mean, that's exactly what's going on. So Governor DeSantis is actually thinking that this vaccine is a silver bullet. And so he's just biding his time until the vaccines come out. And he thinks that somehow this vaccine is going to slow this downhill moving train. And unfortunately, that's not going to be the case. This is a fundamental misunderstanding of the nature of this pandemic. And unfortunately, Floridians will pay the price because, as you mentioned, we have a disproportionate amount of elderly population, and we have a large vulnerable population, and therefore the death rates are expected to go up exponentially, and there's really no mitigation measures to prevent that. So unfortunately, there's probably a few million people listening to this this television cast right now, and I guarantee, unfortunately, that a percentage of the folks watching this will be dead with it by the end of the year. If not so, a lot of the folks watching this, a lot of their family members will be dead in the thousands. And even more than that, a lot of folks will have acquaintances, friends, and folks that they know who will be dead. This is a fact. And the fact that the leadership doesn't really appreciate this is appalling. And there's a leadership vacuum right now where Trump has abdicated all of his responsibilities. And right now, we need Biden to step up and start communicating directly with the American public. And that's why I've been saying that the COVID task force under Biden needs to start communicating with the public directly and holding daily briefings in conjunction with the Trump administration's task force, so that we can get the messaging correct and pursue a unified approach so that we can get the American public on board. Right now, we have to pursue what I call a village mentality, where folks have to do for themselves because, again, our leadership is not doing their job.
Yeah, and you know, some of those people who will be dead will be healthcare workers. I mean, there's already a strike there's some nurses in New Rochelle, in New York, who are already on strike because they don't have enough PPE, they don't have enough equipment to save their own lives. My last question to you, Dr. Ashby. What good will a virus be if folks are afraid to take it? I've had this conversation with particularly other doctors who are Black and people in the Black community. There is a lot of skepticism among people I know, and I'm sure among people you know, who are worried about the vaccine and who don't trust it. And what do you say to those people?
So I don't think folks really appreciate the level of distrust right now for the healthcare system, but in particular the COVID-19 vaccine. I would estimate, anecdotally, based on the folks that I know, maybe about 80% of the folks that I know, educated or not, they're not going to take the vaccine, or at least they're going to wait until folks get the vaccine to see how it reacts, and then make their decision after that. And, you know, the statistics out there estimate, at least the latest Harris poll indicate that about 43% of folks of African-American descent say that they will get this vaccine.
Yeah.
But I think that's an underestimate. And this is going to be a real issue. And unfortunately, the disparities will increase as the vaccines come out because folks simply do not trust the vaccine. And we need to make an aggressive information campaign to inform and educate the public so that they can take the vaccine.
Indeed. Watagwan, indeed. Dr. Bernard Ashby, always great talking with you. Be safe. Thank you very much.